All right. Good morning, everyone, again, and welcome. Muy buenos días a todos y bienvenidos a esta tercera conversación regional. Welcome to the third regional conversation. We're really happy that this collaboration that has been launched this series, and we continue to do so. The event is hosted by the Arrowhead Center at New Mexico State University, Technology Hub in Ciudad Juárez, the Medical Center of the Americas Foundation in El Paso, and Pioneers 21, formerly the Hub of Human Innovation in El Paso. And on behalf of the leaders of these four organizations, Kathy Hansen, Ricardo Mora, Emma Schwartz, and myself, I would really like to welcome you and thank you for attending the session today. I'm Carlos Martinez Vela, and I am the Executive Director of Pioneers 21, and I will be moderating the conversation with support from the outstanding technical team at NMSU in Las Cruces. Before we get started, just some housekeeping rules. After the introduction, our three guest speakers will go in sequence. We will have 20 minutes of Q&A at the end of the conversation. You can submit your questions at any time using the Q&A function that you can activate at the bottom of your Zoom window. So just submit your question whenever it comes up. And then I will be conveying the questions at the end of the three presentations to our panelists. And we're coming together, as you have heard, as some of you who are here for a second or maybe a third time, that we're coming together with a particular goal of really preserving and amplifying the collaborative spirit that we have worked to build in this region over many years. It's easy in a time of crisis like this to just retreat to our corners and our cities. And it is important to have forums like this and initiatives like many others that are currently taking place. We're going to be hearing about one of them today and also next week. And we're making an effort in this series of conversations to bring together the three cities to the extent that we can, and also public, private sector, academia, when pertinent, civil society. So with that, I would just like to very briefly introduce our speakers. We will first hear from Dr. Nicole Brennan. She's a director of health research at Battelle, and she's playing an important role in the ongoing enhanced regional public health partnership that was announced a few weeks ago here with the leadership initially of the Medical Center of the Americas Foundation. Thank you for joining us. Then we will also be joined by Mayor of Las Cruces, New Mexico, Mayor Ken Miyagishima. As we know, cities are the place where this pandemic is most evident for all of us, and cities are also facing fundamental challenges when it comes to their economies, their fiscal health, and certainly what this is going to mean for recovery. And finally, extremely important, representing the private sector, and also the private sector overall in Ciudad Juárez, we will have Álvaro Bustillos. He is the co-founder and CEO of Battelle Trading, but importantly, he is the current president of Desarrollo Económico de Ciudad Juárez, a private sector association that plays a very prominent role in the economic development strategy and that convening role in Ciudad Juárez. And with that, I will hand the floor, the screen, first to Dr. Nicole Brennan from Battelle. Thank you for joining us.
Yeah, thank you, Carlos. And can you confirm that you can hear me okay?
Yes.
Great. Thank you so much. And thank you, everybody, for having me on today. So I was asked just to do kind of a global overview of where we're at in the country as far as the number of cases and the current thinking on continuing to slow the spread, and how Battelle has also been contributing to the scientific efforts geared towards the pandemic. So just real quick, kind of looking at a very high level for the United States. As of today, we have around 1.3 million cases in the country, and it increased by 18,000 cases overnight. And that has had an impact of about 80,820 deaths, which are increasing around 1,000 deaths each day. In Texas, we have just under 40,000 cases with 1,100 deaths. And then if we were to continue to like drill that down to a local level, you know, in El Paso, we have about 1,400 cases, 1,456 to be exact, and 41 deaths. And where we want to kind of even look look more closely at this is how this disease has also been disproportionately affecting our vulnerable populations and the minority populations. So for example, of the total cases in the country, we're estimating that about 28% are impacting Black or African Americans, and yet they only make up 12% of the entire population. Similarly, about 28% of the cases are suspected to be in the Hispanic or Latino communities, which only make up about 17 or 18% of the population. So we can see that minorities are more severely impacted by the disease, and that's an area where we really need to concentrate our efforts as we move forward in preventing, slowing, and testing, and then treating. So, you know, we're in a situation where we have a highly contagious disease, a disease where you can be contagious without demonstrating or showing any symptoms for a number of days. We don't have a vaccine, nor do we have a well-tested and widely available treatment. So, you know, not a lot of good news there, but, you know, we are continuing to look for the best ways to slow the disease. And there's lots of names that you'll see on the internet for some of these best practices. The one that I'm really liking at the moment is called Box It. So this is a 4-point strategy. The first point of that is to test. The second is to isolate. The third is to find, which you might have also heard as contact tracing. And then the fourth is to quarantine. And so when we talk about testing, that really is one of our primary areas of focus across the entire country right now. And there are two main types of testing. So you'll have viral testing, which tells you if you are currently infected with COVID-19. And then there is the antibody testing, which you may have been hearing more about, which tells you if you have previously been infected with the disease. And there are some challenges with the antibody testing right now. One, that some of the tests may show up as that you have previously had some type of coronavirus, but may not have had COVID-19. Other challenges are that it can take a number of days to weeks for you to actually build up the antibodies from the virus, even after you stop displaying symptoms. And so we really have to use that test carefully and with a lot of knowledge on what it does and doesn't tell us. So our biggest area of focus right now is really to continue to get that viral testing out so that we can tell who is currently infected. And so at that point, once we know that somebody has the virus, we isolate. That's where you ask somebody who is positive to kind of stay away from other people, and if at all possible, even within their homes, to kind of isolate themselves from their family members. And as a community, one of the things that we need to really do when we're asking people to isolate is to support that, to help bring them the items that they might need in order to stay home, to provide care for their loved ones if they are a primary caregiver. There's a lot that we can be doing to support those people who need to be kind of separated from the population for up to 2 weeks sometimes. And so then we do the contact tracing, and that's where you ask somebody who's tested positive, who have you had contact with over the past 14 days? And then public health staff go and find all of those people and let them know that they were exposed to someone who has tested positive for coronavirus, at which point they ask them to please quarantine themselves. And so quarantining is when you don't know if you are positive, but you know that you've been exposed to something. And similarly, we're asking you to kind of take yourself out of the general population, stay home, and see if you develop any symptoms. And at this point, where testing is available, also to get tested. If you test negative, continue to quarantine, potentially test again, but making sure that you are not spreading the disease further, even if you aren't showing any symptoms. So, honestly, if we could kind of just like hit a big pause across the country right now, it'd be great. We could attack this box, right? We could find everybody who's positive. We could find everybody they've had contact with. We could isolate and quarantine and really get good control over everything that's happening. But that's just not the reality that we currently live in. Every day, people are still going out. You have to go to the grocery store. Maybe you're going to the bank. You're interacting potentially with your family members or your neighbors. And while we're trying to very much limit that, at the same time, we've got to build this gate, if you will, or this fence around that box of good preventive measures. And I wish I could say that we could build a force field, one that would stop everything, stop all new cases from happening. But we can't. But we really, really must limit and slow the spread. And so what are the things that we can do to slow? We can wear our face covering. We can focus on hygiene, so hand washing. And then if you own businesses, really cleaning the areas that have high traffic, making sure your employees have face coverings. Continue to promote physical distancing and really enhance public education. Why are these things important? What is the impact of us not doing these things? It's hard sometimes to hear that we want you to stay home. It can get very lonely. It can be emotionally difficult. But if you understand the reason why, if you understand why you're being asked to quarantine or isolate, it's easier to do, and we get a lot more buy-in. And we've seen that across centuries of public health around voluntary quarantining. When people understand the impact, they're much more likely to do it. And so, like I said, looking to really slow things down. And slowing creates really the most valuable resource that we can possibly ask for, and that's time. We need time to develop, distribute more tests. We need time to build up our protective equipment, our PPE. We need time to get people who are currently in the hospital out of the hospital so that the hospitals have resources, they have beds. We need time to develop and study treatments that we know will work. And we really need that time to develop the vaccine, to get it out across the country and to distribute it and get it into people. And so when they talk about flattening the curve, it really is about that giving of time to our society so that we can lessen the impact of this, so that we can try and create as many barriers as possible. Because we are all right now susceptible to this disease if we haven't had it already. And so doing those things like face masks can be very effective. And when we're looking at sort of the range of risks, you think about sort of large gatherings. We know that large gatherings, one infected person at a very large gathering has resulted in thousands of cases. And those are more risky than smaller events, but it really also depends on the interaction of the people at the small events. And it's horrible to think that you can't go to a wedding or to a funeral. But we recently had a case of someone who was positive in Chicago who went to a funeral where there's lots of hugging and consoling of people. And unfortunately, 16 attendees of the funeral were infected and 3 subsequently died. And so that is the reason why we are putting out public health measures and messaging to try and help people reduce that level of physical contact. And so, what can you do? You can promote those face masks. You can help people who know how to make them, to get the supplies to make them. I absolutely am never going to be a person who knows how to sew a face mask, but I am happy to try and find the supplies to do it and provide them to my friends, and also to help distribute them out to the community. If you have employees who can work from home, continuing to allow them to work from home is fantastic and something that we should really consider. And then if we have employees who can't work from home, how are we protecting them? What are the measures that we're putting into place to make sure that we're looking out for the entire work population? What are the protective gear that we're giving them? Are we taking temperatures? Are we really effectively cleaning common areas and having staff clean their more private areas? And then, talking a little bit about Battelle and what we do. Our whole mission is really to take science and technology and to turn it into societal benefits. My team has been working very closely with the city of El Paso and the Emergency Operations Center there to also help facilitate the collaboration between the public and the private, because that type of collaboration will make all the difference in how we do in this pandemic, and trying to really pull all of our resources together and all of our minds, and how we address this as a community will create a more positive outcome for our community. And so we've also been looking at ways to protect our sister city in Juarez, and looking at what can we do to get tests there or get protective equipment. How can we decontaminate the N95 masks? And so that is something else that Battelle has been very focused on, which is creating those decontamination units. You might have heard about them in the news. We've been widely advertising that, and El Paso has their unit. They decontaminate N95 masks using hydrogen peroxide. And so each unit can take up to 10,000 masks, and it floods the entire system with that hydrogen peroxide, and then vents it back out. And that has been proven to effectively kill any of the virus that is on those masks. And because that system right now is so close to the border in Juarez, we want to try and find a way to allow masks from Juarez healthcare professionals there to utilize that system, because it really is one community, and everything that we do and don't do will impact us across the entire system. So I think, the global message that we're trying to get across now is that you do have the potential to positively impact this outbreak and to slow the spread by the things that you do and don't do, but also as business owners, also promoting those positive types of behaviors with your employees, and making sure that they have the ability to isolate or quarantine if needed will make all the difference right now for creating that resource of time. So happy to take questions when we get through the end of our presentations here. And thank you so much again for giving me an opportunity to talk with you today. So Carlos, I'll turn it back over to you.
Thank you, Dr. Brennan. It's really sobering and good to hear reality, right? And numbers. Yeah. It is also, important that you to have this broader perspective. The last three conversations we have had have been very focused on our region, right? So now we hear your perspective, what's going on here, but also to remind us of what we can do right here, right now, and that this is, real, real in terms of what we can do.
Absolutely.
So thank you. So if I may ask, just to keep the spirit of the panel and the view of the panel, if both Álvaro and Mayor Miyagishima, who just joined us, can turn on their cameras so that all of the attendees can see you and can see all of us at the same time as a panel. That would be great. Mayor, are you there? Just I know you joined a couple of minutes after, so just want to make sure that we have you with audio and video. I think we have audio now. We'll just give a few seconds. maybe perhaps Álvaro, would you be okay going second? Yeah. All right.
Thank you, Carlos.
All right. Well, thank you. Now we have Álvaro Bustillos with us, who is the the CEO of Vaquero Trading, a very prominent business in our region, which we're all very proud of, and also president of Desarrollo Económico de Ciudad Juárez. Thank you, Álvaro.
Okay, thank you, everybody. Thank you for hosting me here at this conference. Well, I would like to break up my intervention in 5 parts. The first one is I wanted to tell you a little about Desarrollo Económico. Desarrollo Económico is an organization in Ciudad Juárez that we represent the interests of 7 business leaders in the region, and we're integrated into looking into private initiatives and strategies and projects that improve the quality of life of the people in Ciudad Juárez. So the way we work is we work alongside with public representatives and the academia, and we work into trying to solve problems, into seeing what could be better for a region. Well, we started off with basically what happened in the last couple of months is with the contingency. We, as Chihuahuans leaders, we came together and talked to the government, since some of the decisions sometimes in the government take too long. So we try to coordinate accordingly with all the organizations in Ciudad Juárez to try to come up with some initiatives to try to do a front into the crisis in contingency. As you may know, we were 15 days behind from Paso. So what we happened is we came together as civil society to look at and structure a table that's called the contingency table. And we get together every Tuesday and Friday where we're keeping up-to-date reports about what is going on in our region and in the whole state of Chihuahua as a whole state. And basically what we came up with 4 pillars. We work pretty close into the first. The first pillar is looking into the health side, where we're looking into every detail that's happening in infrastructure in the hospitals, and basically trying to coordinate with authorities, see what they're missing, what is the news that's breaking up with some of the people that are getting infected, and how many of the people have deceased. The second pillar is very important, which we know after the crisis of the health will come economic crisis, along with the hand of what is everything that's happening in our region. And we're trying to keep up to date, looking and talking to the main industry players and see how it's been affecting to all of them, and looking after their job security of a lot of these families. As you may know, the region is very focused on the maquiladora industry, on the manufacturing. So what happens there is we've been very affected with some of the shutting down of the plants. Okay. The third pillar is we've been working with the food programs, food banks, which is led by another organization, and we're trying to keep securing some of these people that are behind with that don't have access to some of these food programs. We're trying to work very close with the mountain people in Cuauhtémoc and all those communities where they're very behind on food security. So we're trying to make donations and work along with the food banks to take those resources up to those parts of the state. And the last part, which is very, very hard and consequential one, is the security. We're very worried about everything that the crisis will bring up to the date that we're ending up today, which will increase dramatically once people don't have job security. That could affect very bad into our region. So we're working, having at least our authorities and our police forces to have the order, have them prevented with the right equipment so they don't get infected, and having them up to date into putting the government and the governality of their city to be in order for everything to work. Well, talking about the health issue, up to Friday, we had 800 people infected, out of how 132 had already deceased, dead, and 65% of them happened in Juárez. As you may know, we have 3 types of hospitals. It's hospitals is basically, we have the federal hospitals, we have the state hospitals, and then we have the private hospitals. Mainly, almost 90% of those deaths have been happening in federal hospitals, where they don't have the capacity, and it's been very difficult to coordinate with federal authorities. They've been shut down, and what we've tried to impose is try to test and make more tests for people to prevent from being contaminating other security regions. See, out of the people that have that we have confirmed that had the disease, we can say 60% of them are male, 40% are females, and out of the 33 hospitals that we have in the state, 10 of them are in Juárez. And it's break up in where 4 of them are part of the state, 3 of them are federal, and 3 of them are private. See, out of what we came up, we in Ciudad Juárez, as you may know, we have excellent leaders that came up with 2. We're gonna call them a trust. These trusts are mainly managed by business community, where we imposed upon ourselves an extra tax into the income tax. So every time an employer pays their income tax, we have over a 3% over that percentage is given to those trusts. But that incremental is charged by the state, and then it's deposited into those trusts. Well, what we did into this contingency is we have been managing those funds, and we're stepping up to the plate where we can solve some of the issues that we have through those trusts. And that's the person that leads one of these trusts, which is called FECHAC, is running this table where all organizations sit together and come up with solutions against the contingency. Okay. Up to today, the trust has given 40 million pesos, and we've tried to work with a lot of other foundations and organizations where we up to Friday, we were able to secure another 10 and another 35 million for the other trusts. So overall, we have already almost 100 million pesos given by these trusts and organizations that work alongside the private initiative. As you can see, the private initiative is the ones that are stepping up to the plate. We've been trying to coordinate. We're the ones that are having the first initiative in a lot of these fronts, and we're the ones that are working pretty tight into making things happen. Now, jumping into the economic side of the deal is what's going to affect in our region. As everybody knows, we've been seeing a huge, massive layoffs in the U.S. Just putting some things into perspective, which will eventually turn out into less buying power, and it'll affect our manufacturing and commerce capacity. See, Mexico will also have a huge unemployment, and Chihuahua will not be the exception. As we can see already from the most optimistic side of things, we're expecting basically more or less, if we see it in an optimistic, it will be from 45 to 65,000 layoffs in the whole state. And if we go into a very pessimistic, it could go over 100,000 layoffs in the next couple of months. What I've been working pretty tight I've been involved into already 5 committees that are working into trying to establish an economic and a reactivation for our state, our city, and our region. The state one is, as you already heard her the last session was, it's led by Alejandra de la Vega, which is our state secretary of economic and innovation, and we as Desarrollos Económicos, economic development organizations, we're working very tight along her to try to create the initiatives that will work in the coming months to try to seize those opportunities and establish the programs into the state of Chihuahua. As well, I've been participating with the mayor of Juárez and trying to coordinate it alongside with some of these initiatives that we have at the state level to try to implement them into our city. And it's been very good to work alongside with him, because it's you could see that that they're hearing the business community. They've been very involved, and they're trying to make the initiatives to recuperate our economy as quick as we can. As you may know, our governments with all these crises will also be very affected in their financial accounting. So that will create less infrastructure, will create less spending into our states. And we have a big issue and a hurdle to cross those metrics for us to create the job security that we need. Basically, looking into some of the opportunities that we could find into the negative perspective that we're seeing is that one of the things that I think it's going to be good for our region and for Mexico and U.S. is that we've seen the U.S. already secure his 5 most important commercial treaties. Based in importance, we can see that Mexico is his most important commerce partner. When we saw the TMEC already pass by, then we already saw how he secured with Japan and with South Korea and with the UK. So what we have a big opportunity is bringing some of those value supply chains back to North America. And I think Mexico, as his demographic sees it, we have the biggest opportunity to capture onto those opportunities. I think some of the sectors where we need to focus would probably be auto, textile, electronic, heavy equipment, semiconductors. And as you may see, we are working into some of these country of origin labels that we want to establish them as North America origin labels. I think US will try to impose some of those value chains to come back to North America, and that's where we need to seize those opportunities. Going into the pillar of food banks, what we can tell you is that we already at the state level, it's been given almost 15,000 despensas, and I saw Laura Munoz here. I want to recognize her because she's given a lot to the state and given a lot to the business. Some of these people that have more necessity than others. So they've given already almost 12,000 despensas through the food banks, and what's given they're working mostly into the mountain regions where you have the indigenous, like the Tarahumara people, that we're trying to help them and have their food security be established. Going into the security front, as I told you, one of the main issues is that we already, through one of the trusts, already invested 40 million pesos into the whole state just to have our security forces healthy, active, and functional. Those are the ones that we need to protect the most. And at the end, what we need to try to do is try to stop the increment in crime, try to lower the rate of impunity, which has been, that's the worst of our problems. That everybody that some people that go and commit a crime, they have impunity, and sustain the functionability of our government. So we need to establish the law and order into a region, and that's one of the main issues that we want to keep happening into our region. As you may, up to Friday from when the contingency started, we're almost in the dead of double the crime rate of deaths from assassinations from the COVID-19. So you could say that's 200 already assassinations compared to 130 people that have died from COVID. If anything, if anybody wants to ask any questions, I propose to you to go through the Q&A. And if I think that's all for my for whatever I wanted to communicate with you. I want to thank Carlos and Ricardo for inviting me, and I'll leave it open for Q&A. Thank you.
Álvaro, thank you. I mean, it's what you describe is a really good reminder of the multiple facets of the crisis, right? Health, economy, humanitarian, security for the region, and in the economy, both the personal economy, the job security, and also manufacturing and value chains, and what this represents. Just as a reminder for the audience, you can submit your questions in the Q&A session, and at the end, we will discuss with the panelists. And now, Mayor, thank you for joining us, Mayor. If you could unmute yourself.
Yeah, thank you.
An honor to have you. And you know, you bring a very unique perspective in the sense that it is from one of the three sister cities of our region, but also cities are, I mean, rural areas are suffering a lot through this, but this started in cities, and because of the nature of cities, right, these have become the concentrated areas where this is happening in terms of public health, but also in terms of, you know, the fiscal health of cities and so on. So we're looking forward to hearing your perspective on Las Cruces response and perspectives on recovery on these various fronts.
Sure. Well, thank you, Carlos, and I'm sorry for the noise. I'm here in my personal office, not in City Hall, and so what started out to be a little seal of a window, the window fell and broke, and so literally the street noise is right here. So I have a mini blind that's closing it, but that's basically it. So all right, so to get started, probably, you know, you may want to ask me some questions. I will tell you that we are keeping internal numbers, keeping track of internal numbers here in Las Cruces, and about 70% of our cases are actually outside the city. So they're in the underlying areas like Chaparral, Anthony, Sunland Park. So that's one thing that we recognize, that it's a little bit different. You know, we recognize that those are, of course, our friends and neighbors down the road, but you know, we're trying to figure out, you know, how that's happening there. And I don't know. I know Chaparral is just minutes away from El Paso, and I don't quite understand how it's getting. It's moving pretty fast over there in Chaparral, so a little concerned about that. You know, we have some theories, but nonetheless, that's just some theories. But we're doing our best here in the city, and just, you know, working at keeping, of course, social distancing, reminding residents to wash their hands often, wear a mask if they can when they go outside to various places that they visit. I'm sure you've probably heard that this Friday I'm going to probably do an emergency order that voting starts on Saturday, early voting at City Hall, and that all people need to wear a mask. And if they don't have one, we'll have one available for them. And we're just trying to ride this out to the best of our ability.
What is the impact that this is having on the fiscal finances? I mean, I think as in every city, what is the outlook that you see for this?
Well, we're going to get our numbers at the end of the month. we're probably going to look at least our gross receipts probably be down about at least 10%, possibly more. But we're pretty much in a pretty decent position. I don't see us doing any layoffs or furloughs or anything like that. We have a couple layers of backup finances, and we have a really big one if we ever needed it, and that's a good chunk of money that we could tap into if we need to sustain ourselves. So we don't like to brag about that too often, but when asked, we'll share that.
And what is your perspective on collaboration between, or what has been your experience so far, and what could be changed or improved in terms of collaboration with Ciudad Juárez, with El Paso, in this moment in which collaboration is so important?
Well, I appreciate Mayor Margo and Judge Samaniego asking the Governor Abbott to, maybe it's not, if they could kind of get exempt from opening up their communities as quick as, say, other parts of Texas. Because if they do that, there will be some of our residents in Las Cruces and Doña Ana County who are ready to make that leap and drive over there. And if they can kind of keep it at bay, that would be really helpful. Because, it's an invisible enemy here. We don't know where it's at, and we don't know where it's lurking, and just we have enough here. You all have a lot there, and we just keep it steady for a few more weeks would be nice. But we can't make them not go. We recognize there's a lot of people who still work in both cities. A lot of Las Cruces work in El Paso. A lot of some El Pasoans work in Las Cruces, and we recognize that. But I mean, if you're just looking to go have a meal somewhere, just just stay home in Las Cruces and order here, takeout. Designate a room in your house as your restaurant and have fun.
Thank you, Mayor. So, and just one final point for you, if you would like to offer a perspective before we have the full Q&A question about your work with state government. How is that playing out right now? What is the role of state government in your local response in the case of New Mexico?
Yeah. Hold on one second. So the governor has this committee, and recognizing, I know I wasn't put on it, and I tell some of my friends, I said, it's actually okay. I mean, I communicate with her often. I bounce ideas off her. She and I have a direct, if I need something, I'll email. I can have literally her right-hand person. I'm fine. If anything, it just, but it would be nice to have our perspective. But nonetheless, I still share it with her. I send her updates, send her some of our graphs, and send her some of our information. But it's been really good. The state's been good to us. I can't complain.
Well,
really.
Thank you, Mayor. Thank you. Appreciate it. Well, and thank you all for offering these three perspectives, very different, but at the same time complementary. And we have a few questions, and thank you to everyone who has submitted a question. As you know, in this format, there is an opportunity to submit tens of questions, and it's impossible to go through all of them. So I take responsibility for the ones that we're going to ask. We will follow up as needed. Following up a little bit on what you were saying, Mayor, and this might be a question for Nicole, if you could offer some perspective on this, and perhaps for Álvaro too. We are different cities, different regions, different jurisdictions, right? And what kinds of complexities from the perspective of the response that Battelle is involved in, what does that represent, and how can we manage those complexities better? Dr. Brennan, I don't know if you could offer a perspective on that.
I think just as the mayor was mentioning, as far as complexity of movement of populations and having sort of different jurisdictions and some different rules in those jurisdictions creates a a complex environment, how Mexico's responding versus how the United States is. And then each state has the ability to make their own decisions on opening back up. And so having some of that collaboration at the local level, as the mayor was just suggesting, is really critical. And then the complexity of populations. Again, when you have when the majority of your population may have comorbidities or a lack of access to healthcare, or may have had a lack of access to healthcare for a long time, that makes them more susceptible to negative outcomes from the disease. And so those are the things that we really have to take under consideration when we're looking at how to prepare and how to make sure that we have enough equipment available, for example, like dialysis machines or fluid for dialysis machines or oxygen tanks that people could take home with them. You know, all of those things are pieces and parts that we need to understand about our population when we're making our plan for response.
An incredible challenge, but complexity, right, in terms of that it creates.
Right.
Another question that we have, it relates to minority populations. We are, you know, you brought it up, Dr. Brennan. We are on the U.S. side, we are a majority-minority region. And this has some of the hardest hit population in the U.S. And then, you know, Álvaro mentioned the humanitarian side of it, the vulnerable populations that are, you know, within the city and outside of the city. How, if you could, three of you perhaps offer a perspective on how this relates to the question of access to testing, right, which was pointed out as a key to the response, right, in terms of, does it cost something or is it free, who has access, and then in access to healthcare, right? In the case of, you know, Mexico has this mixed public-private healthcare system. Here in the US, we have the private healthcare system with the insurance question, right? So it's a question about how does the fact that we are in this majority vulnerable population, how does it relate to access to testing and to healthcare? I don't know who would like to go first.
So I'm happy to talk to it, and I'd like to hear also, you know, the mayor's perspective and overall also. But absolutely right, when you have very few testing locations, but people who may not have a capacity to get to that location, maybe they don't have a car, that can create a lot of difficulties to making sure you're utilizing all the tests that you even have. And so doing mobile testing or making sure that testing is available in communities where people can get to them, or along public access routes, something, just keeping all of those things into consideration. And I had seen this question, that's why I kind of brought up also the comorbidity piece, because we do know that minority populations tend to be more impacted by comorbidities and have higher rates of them, and that can be very serious. And a lot of that, again, is tied back to just having good access to healthcare on a routine basis. And so if anything good comes out of this, hopefully it will be increased recognition of that. Mayor, I think that New Mexico has done a really great job of communicating where testing is in lots of different locations and getting that out there. So interested in your perspective as well.
Thanks. You know, one of the things in the early beginning when, like I said, sorry, I mean, you're hearing noise right here, but Albuquerque was able to do a lot of quick testing because some of the major laboratories were there. And so I just got word, let's see, when was it? May 3rd. So we have a small laboratory here, privately owned, by the way. And he had texted me early part of this month that they're looking to do some increased New Mexico testing by 25%, which the governor desperately. It'll be here. And I think that that's going to be key, you know, because like it's been said in the past that people are asymptomatic, they don't have to show the symptoms, but they may be a carrier. And so if they can find out that they actually have it, and then they can self-quarantine, that can also reduce the spread. So I think that's going to be key. I think I think a lot of times it's going to be easier for our friends and neighbors in the north part of the county to come to Las Cruces. I recognize that those in the South Valley, I mean, El Paso is just right there. So if there is a way for them to visit testing there and work with El Paso County or just right there, that would be really helpful.
Álvaro, what's your thoughts on what's the status of this in Juárez?
Well, as I want to point out two things. One of the things is as the authority that our major here has, and also being Margo, it's very different from the authority that our major in Juárez has. Some of the decisions that need to be taken in Ciudad Juárez need to be taken by the state level. So that's where we're already in a disadvantage, where if we need to take decisions pretty quick, they need to be consulted into the state level, and then the state level will tell you they need to be consulted into the federal level. As you may know, I've been a big promoter of opening up already the economy, because in Juárez, people are safer in their works. You know, all these big maquilas or companies will take better health protocols than these people outside in their homes and in their social life. You can go to Juárez and think that they think they're in vacation. That's why I've been a big promoter of them making people go back to work, because they'll be safer and they'll be better off working in their jobs, because all the health protocols will be taken there, especially if they're an international company. Number three is, one of the big things is for us to have access to the testing kits. As you may, I don't know, between the federal level, the state level, they throw the ball back and forth, and I've been asking the authorities to let us import some of these tests. They're not even costing to our authorities, because some of the companies want to buy the test, but there's nobody. They told us about two specific tests that they're the ones that they would let us import. So it's been very complicated for us, even though the private companies and the private initiative are trying to buy those tests and give them to our people. As you may know, always the government is a very big hurdle to jump in Mexico.
Incredibly complex across the board, right? All the priorities there. Thank you, Álvaro. Just a very before we go to our final question, a couple of questions. There are a couple of very quick point questions. One of them you might be able to answer, Dr. Brennan, which is about the decontamination system from Battelle. I mean, the question is, will it be available to Las Cruces as well? My understanding is that it will, but it's for the whole region, right?
Correct. Yep.
Yeah.
And so that's being managed through the Borderplex. And so, yes, Battelle will decontaminate masks from healthcare providers as they arrive to the unit. So if you can contact the Borderplex representative, they'll sort of give you all the instructions for how to sign up. There's a contract between Battelle and the healthcare provider, and you just have to kind of fill that out and get your number to label on your mask, and then you should be good to go. But yes, they're available for any mask that can arrive.
Yeah. One more question. I think a final question. There are other really good questions. We just have 5 minutes at this point. One of them, which maybe at the end you can, if you want, give your perspective. How long is this going to last? I think it's a question in everyone's mind. I don't know if you want to address that right now or in any way.
Yeah, that's so right now, all of us, if we haven't had it already, are susceptible to it. And the only thing that's going to stop this is a vaccine, or everybody getting it and developing the antibodies. So the herd immunity, I'm sure you've heard that term before. It's when enough people have had it that it can't continue to spread throughout the population. And so we would certainly hope that we're not going to get to a spot where it sort of gets through everybody before we get to a vaccine. But, you know, if they're projecting that that's off still by 15 months to 24 months, then, you know, it's here with us for a long time.
Thank you.
Sorry.
It's a reality. The final point, you know, a few of the questions point to the, and on your remarks pointed to the complexities that this represents in terms of, you know, with different states, different countries, different cities, different priorities, different approaches to this whole question. There is another point about the complexity of living in democracies, right? In democracies where are very complex, noisy, and unwildly sometimes, as they are supposed to be in many ways, right? It's a democracy. So the question here is about, you know, there was one question, well, how are you going to enforce social distancing? Are you going to put people to jail? It's a democracy, right? I mean, but I guess the question, to turn that question in another point is, what can be done? This is a question for the three of you from each of your perspectives, to better engage the citizens in the response, in the kinds of responses that are required for this, and if you were to tell each of us as individuals what we can do in terms of our part as citizens to aid in this response, what would be, or what's your message? Mayor?
Well, probably to, if they go out to any business or any, you know, other than their personal residence, I mean, to consider wearing a mask, face covering of some sort. If they go into a public building, to definitely please do that for the safety of the public and the safety of the employees. Wash their hands pretty frequently. And if they feel like they're ill, you know, if they can stay home, you know, and if they still feel ill after a day, you know, maybe contact their health provider and ask them you know, what they think. And if, you know, maybe later if they need to get tested. I mean, the main thing is to protect not only themselves, but their friends, the neighbors, the members of the public. But if they're going out, you know, of course, if they're just by themselves and going out for a walk, you know, probably don't need a mask. But if they're going to go visit a store or do some shopping, you know, I think they should do that. I think, and wash surfaces. Just have some gloves handy, some sanitizer if you can. Just be very cautious.
Thank you. Dr. Brennan?
He stole my answer. But yes, exactly that. So let's please cover your mouth, please wash your hands. If you know how to make masks, please make masks. If you can donate food to your local pantry, do that. You know, giving back to your community. If you can help somebody who is older or who has severe illness otherwise and would not do well, if they had to go to the store and got infected, please help out your neighbors in that way, and leaving groceries on their doorstep or in front of their door. Those are little things, but very important things that we can all do to have a mission for ourselves, but then also give back to our communities.
Thank you. Álvaro, you have the final word.
I would just keep social distance. If some of these businesses or industries can work from home, I think the next 2 weeks will be very critical, and I think we need to keep them safe and try to make our best effort to try to contain the crisis.
Right. Well, thank you, Mayor Miyagishima and Álvaro and Dr. Brennan for joining us today for this very important and informative conversation for all of us. And thank you to all the attendees. We will be sending additional information, and we have another conversation scheduled next week with Mayor of El Paso, Di Margo, Emma Schwartz, President of the Medical Center of the American Foundation, and Jason Leonard from Tricor Reference Labs in Albuquerque, New Mexico. So it should be a really interesting conversation. You will be getting the announcement and invitation soon. Thank you again to our three panelists, and on behalf of all the hosts of this series of conversations, thank you to all the attendees for joining us, and have a good day.
Thank you. We'll see you later.
Thank you.
Thank you.
Thank you.